Hey everyone, it's Dr. Erica Person, and welcome to another episode of Flex Audiology. Today we are going to jump right in and talk about how much do hearing aids actually cost. Before we do that, if you could do me a favor and hit that subscribe button, I really appreciate it. It helps grow our channel. So that's the number one question I get asked is how much do hearing aids actually cost? And the short answer is it depends. They can range anywhere from several hundred to several thousand. It's really based on a variety of factors. So let's unpack what those factors are. That could be your technology. It could be the service that you're purchasing. It could just be based on your unique hearing needs. And so let's go through each one of those, and then I'm going to get into some actual numbers at the very end. So technology levels. Most hearing devices come in a basic, a mid-level, an advanced. You might have seen them as entry to premier. You could even see them listed as numbers 1, 2, 3, 4, with 1 typically being your high-end hearing aids. So your basic hearing aids, what they're going to do is they will create amplification in quiet environments. They're great for one-on-one conversations. They're great for watching TV. But they are a little bit more limited in complex situations. Now, with hearing devices, that's just one component. For some patients, they might need accessories, and that is a whole nother talk. So if you are a patient that needs accessories, you actually can do pretty good with basic hearing aid technology as long as it is coupled with an accessory to get you through those more difficult listening environments. A lot of my patients aren't necessarily sold on whether or not they want to use accessories or not. So then we start looking at mid-level technology and advanced. So mid-level technology, it's going to be like we're just layering on top of that basic hearing aid. So we're going to add a few more features. The background noise reduction algorithms, they work a little bit more. They're a little bit more sophisticated, so they work better, and the actual audiologist has more room for flexibility on how great those features work. And then you get into your advanced hearing aids. Those advanced hearing aids, they have the most sophisticated noise reduction system, and a few of the new ones on the market are now playing around with AI. And I say a few, almost all hearing aids have some form of AI in them, but some of them have dedicated chips or they have dedicated programs specifically just for that AI component to kick in. What that does is it really helps capture that speech in those noisy environments. So think about your restaurants, your bars, your large group gatherings, family reunions, things like that. Very dynamic. And patients really have been coming back just wowed over that AI technology. So as you might expect, as you go up in technology, generally the higher the cost comes into play. So it's not just about coming in and saying, I want the best of the best. Really, we want to take a look at your lifestyle and choose the most appropriate technology level for your needs. Okay. Then we're going to look at the service delivery model. And I'm going to break it down into really 3 separate components. One is just your traditional bundled care. This has been around for ages. So this is where you pay one single upfront cost. That includes the devices and then all of the professional services. Now, services could be programming adjustments, Bluetooth, repairs, different warranty information on there. And it's usually for a set period of time. Most of them typically follow the warranty of the devices. That's usually 3 years. I have seen practices where they bundle in the service for 5 years, and I have seen practices where they bundle in lifetime services. So as you can imagine, depending on how much service they are bundling in, the price can really get up there. Okay, don't be confused that the price of the devices are that much. It's almost always the services after the fact that are driving the cost of that price in a bundled care model. The second model, which is what Flex Audiology follows, is what's called unbundled, or it's an itemized care. And then within those you can get care packages after the cost of the device. So just like I said, you pay for the actual device themselves, and then you're going to pay separately for the services as you need them. Almost all practices that follow unbundled or an itemized care, they do give you services within a set period of time, usually 30 to 60 days, just to make sure that your brain has adapted to the sound quality and to verify that the actual devices that we chose together is working for you. So usually in an unbundled or itemized care package, the initial cost is significantly less. And then depending on long-term service options, it can start to cost, it can add up. The cost can add up depending on if you're somebody that needs a lot of follow-up and a lot of care. Almost all unbundled or itemized practices that I've seen do offer care packages for their patients, especially if we start to notice that you're somebody that needs a little extra help compared to some of our other patients. And then the third delivery model is going to be over the counter. These devices are sold directly to consumers. It's usually without a hearing test or a professional fitting. So usually you're doing the hearing test over your phone. That programs the devices, and then they give you some little limited adjustments. You just have to be careful with over the counter that you're truly getting prescription hearing aids and not just fancy amplifiers, because that's going to be a completely different experience. So here at Flex Audiology, of course, we offer an unbundled itemized care, and then we'll look at those care packages. Okay. And then the third thing to look at really is your insurance coverage. So insurance is a huge factor when it comes to purchasing hearing aids. Generally, insurance does not have hearing aid coverage. However, depending on certain areas, unions, who you work for, some insurance plans do offer a true hearing aid benefit that could cover the cost or a portion of the devices. Some insurance requires that you use what we call a managed care program or a third-party vendor. And if we have to deal with those type of entities, now we're looking at limited selection of hearing aids models or even providers. And so we always recommend that you check your benefits before making a decision. However, if you choose to come to us, we will definitely check that out for you. So what is the average cost? The average, again, it does range, but a single hearing aid can be anywhere from $1,000 on up to $3,500. And really just our area of Lawrenceburg, Indiana, I don't know if I've actually seen any prescription hearing aids that are lower than about $2,400. There may be some out there, but that seems to be the lowest that I've seen when people have brought competitor stuff over. And I have actually seen it as high as $10,000 to $12,000 in our area. So initially I would have told you that geographics play an issue, but we're a pretty small rural community. And so hearing aids here, some of them I've seen as $10,000 and $12,000, that is because they are a bundled delivery option. And so they were building in that service over really the life of the hearing aid is the way that I've seen it presented. So it is a wide range, but that's why it's unbelievably important that you ask questions when you're going through the consultation with your provider. And then you have to make that decision on your technology level, your accessories or not accessories, and then what kind of service delivery do you want, and then whether or not they work with your insurance. There are not very many people that choose to work with insurance when it comes to hearing aids because there's a lot of different plans out there and it can get pretty messy. So it's just really important that you understand what you're paying for and that primarily the true cost, when you look at not only an itemized practice, but somebody that's bundled, you want to ask them how much of that bundled price is due to professional services. So that way you can truly compare apples to apples. And then does that practice follow best practices? Are they running your devices in a test box to make sure they're working before you show up through the door? Are they taking measurements of your ear canal and doing real ear measurements? That way the prescription of the device is set perfectly to you and because it's unique to you. Are they educating you about oral rehab opportunities? Are they providing additional treatment options such as auditory therapy or different accessories that you might need later? So it's not just about the device, it's about the full comprehensive care package. So hearing aids can be quite an investment, but it's one that pays off for communication and just really overall quality of life. If you're curious about what solutions work for you or what your insurance might cover, definitely reach out. If you have any other types of questions, probably the one thing I forgot was the style. So for I'd say in the current environment right now, the style, so if we're talking about over the ear, in the ear, rechargeable, non-rechargeable, it doesn't seem to affect the cost of the devices as much as what it did even 5 to 10 years ago. So I don't put much stock into the cost of the devices changing just based on the style. There's probably still some practices out there that do that, but by and large, practices are paying for the technology level, not necessarily the style of the device itself. So again, if you have a very specific question about a technology level, a style, please reach out, ask me, and we're a pretty big open book here at Flex Audiology. So we look forward to working with you. Hope you guys have a great day.